The broadcast is now starting. All attendees are in listen-only mode.
Thank you for joining the After School Special today. It's being hosted by the Iowa Department of Public Health and the Brain Injury Alliance of Iowa. Today's presentation is Managing Challenging Behaviors within the Classroom Following Brain Injury. This webinar is being recorded and your lines have been muted, but if you have any questions, feel free to post those in the question box and we will get to you as soon as we can. Following the webinar, we ask that you complete a brief feedback form that will pop up on your screen. Attendees that complete that survey will be emailed a certificate of attendance by the end of the day tomorrow. So without further ado, I'd like to introduce our speaker, Maheen Pear-Kramer. She has her master's in special education and received her training in applied behavioral analysis at the University of Kansas. She received her bachelor's degree with a double major in psychology and human development and family life with an emphasis in children with disabilities. Maheen completed her undergraduate practicum at the Early Childhood Autism Project in Lawrence, Kansas, and her graduate student teaching at Hillside School, a special education school that specializes in brain injury in Waterford, Wisconsin. Maheen is a board-certified behavioral analyst and is licensed within the state of Wisconsin as a behavior analyst. Maheen has worked with both adults and children with challenging behaviors across multiple settings, including home, school, and community settings, as well as larger residential settings. She has worked with people with a variety of disabilities, including but not limited to autism, brain injury, developmental disabilities, emotional and behavioral disorders, and ADHD. Maheen has presented nationally in the fields of brain injury, applied behavioral analysis, and in education. Thank you, Maheen, for joining us.
Thank you. Thank you for joining. I'm glad that everyone was able to join us today, even though it might be very cold where you're at. It sure is in Wisconsin. So we're going to start today talking about challenging behaviors in the classroom, and I'm going to have quite a few different, several different handouts. So if you are interested in having those handouts via like a Word document or a PDF document, if you want to just email me, make a note and then email me, I can forward those to you as well. All right, so today we're going to review the limitations and challenging behaviors that students with traumatic brain injuries might exhibit, as well as individual assessment methods, as well as identifying kind of the impact that traumatic brain injury might have on a student with a student that you might be working with. So then we're going to look at proactive behavioral strategies, just in general, good practice strategies to minimize challenging behaviors, as well as then a couple of case studies. And as Maggie had mentioned, if there are questions or anything like that, you can type those in, and we'll try to get to those at the end.
Maheen, sorry to interrupt.
Yes.
We're getting a comment that it's difficult to hear, so if you can adjust your microphone. Otherwise, if folks want to turn up their volume just a little bit, try that as well.
Okay, is that better? Do we think that that sounds a little bit better there? It looks like it's hitting a little bit higher on the...
I'm not getting any feedback back. So if you are having difficulty hearing still, feel free to put in a... Oh, now we got hearing okay.
Okay,
thank you.
Sounds good. And so, as I said, then we'll just review some case studies, and if there are any questions, just let us know. All right, so behavioral dysfunction and challenging behaviors are a pervasive element or component of pediatric adolescent brain injury. It's something that's very commonly seen, and assessment and treatment can be very complex due to the range of physical, medical, cognitive, and behavioral factors that might be present. So we'll talk a little bit about how to identify some of those other factors that might be impacting their behavior as well. Behavior disorder classifications following TBI can be active, where they're explosive, they're aggressive, impulsive, disinhibited, meaning that they can't control their impulses, they're acting out very quickly. They might be having sexually making sexual comments or things like that that they didn't used to if you knew them before their brain injury. It could also be things like that are passive, so lack of insight, slow to respond, they don't seem to have motivation, or they're not initiating things. And so we'll talk a little bit more about that as well. So things that are more internalized or are not as big of problem behaviors, but that still impact their education quite a lot. And then they could also be syndromal, where they're maybe manipulative, they don't accept yes, they don't accept no, they're really persuasive or really trying to get their way. They might be ritualistic or perseverative, where they're repeating things quite a lot, or they're repeating patterns. And it could also be cyclothymic, meaning that they have extreme mood swings, and that might be something that is part of the impact of their traumatic brain injury. Also, you will want to make sure that you're ruling out any potential medical issues as a first step. So anything that's not already being addressed, or that might need more treatment or more evaluation as a medical issue. So what are some of the challenging behaviors that you might see? So it could be anywhere from physical aggression, property destruction, again, those outward explosive behaviors, verbal threats, swearing, name-calling, yelling, swearing. Could be spitting or self-injurious behaviors, so still explosive but towards themselves. Might also be suicidal threats or ideation, suicidal behaviors, elopement, where they're leaving the area, maybe jumping up and then leaving, running away. They could also be defiant or have refusals. And again, that emotional instability that we just talked about, the cyclothymic behaviors. Or they could be isolating or withdrawing. They could also have disinhibition, as I mentioned, or anxiety, perseveration, impulsivity, and distractibility, which can really impact their success in the classroom as well. So we're going to talk about analyzing these problem behaviors and what steps we need to go through to really develop a comprehensive plan for them. So we'll talk about indirect assessments. We will also get the records from the hospitalization or previous placements and be able to get information there, as well as interviews with really important people in that student's life. And then we'll talk about direct assessment and observations, important data collection systems that might be helpful, as well as then a team brainstorming process that we will review, and there'll be examples there. All right, so first we're going to do indirect assessment and what that looks like. So first, you really want to get a good comprehensive personal profile. And so you're going to interview the people that are important in their life, so that's listed on the right-hand side of your screen. And you're going to identify the important relationships, the places that are important to them or that they spend time at, the background. You also want to look at their personal preferences, and we'll have some more questions in the interview portion that will focus on this. But the things that I like to look at is kind of separating them out into two different areas. One is the most important things. And these are the things that if that person didn't have access to them, it would really impact their quality of life or impact their ability to be successful. And so those are really, really important things to them. And then their strong preferences are things that they like but don't necessarily impact whether or not they have a good day. You know, they're things that they like, but it's not going to impact their quality of life. You also want to look at hopes and dreams, and also fears. So what are their goals? What would they love to do? What do they want to do, you know, short term, long term, as well as what would they want to do if disability, you know, money, all those things were not a factor. So what are their dreams? And then also, what are their fears? Do they worry about, you know, people not liking them? Do they worry about, you know, maybe being in another accident? Or, you know, what are the things that really kind of hold them back? Another thing that you want to identify are those support needs. So this is something that you might get through interviews. It also might be through the records review. What are the ongoing needs that they have following their brain injury. And then you also want to identify their strengths and skills and things that they're really good at and like to do, because you're going to use those to build upon that success. And so then you're also going to want to do those interviews. And so some of the interview questions that you're going to look at are what challenging behaviors do they exhibit. So first off, what are the challenging behaviors that you might be looking at? You want to define each of those problem behaviors in detail. You want to look at, what does it look like? How often does it occur? How long does it last? And what impact does it have on the environment? For example, if they're disruptive, but it seems like a minor behavior, however, the impact in the classroom might be more extreme. So, so I think that's something that you want to, look at in terms of impact. We do have a question, so we'll go ahead and take that. Maggie, when you're ready.
Yep. We had a person ask, do we ask each, and this probably goes back to the last slide, do we ask each individual the same series of identifying questions?
You want to, there's certain questions that some team members might not have the answer to, but I think that it's good to ask, a lot of the questions. You might not ask all of them, but I think that getting information from a variety of perspectives kind of can build a larger, more comprehensive kind of personal profile or more complex information. So I think it's good, but there could be some that maybe you don't ask as in-depthly and things like that. And I can talk about those as we go through some of those questions.
And I think you answered the question. I got to thank you.
Okay, great. And then we also want to look at, is there an order or a sequence to the problem behaviors? So is there something that happens first? Or are there signs that they're starting to get upset? That might be something that you can identify, and that might be an area we want to plan for an earlier intervention rather than waiting for the problem behavior to become more severe. So you want to kind of list those out in terms of severity. So what are some earlier on things or least severe, and then what's the most severe problem behaviors that they might exhibit. So then you can plan at each of those different stages, and also recognize when something's coming up. And then what are the activities where the problem behaviors do not occur? What activities reliably have the problem behavior occur? So you're identifying what are the different situations that are successful and what are the different situations that are less successful. And then you also want to look at the positive side. So what are the positive social behaviors that each of those individuals that you're interviewing see, and how often do those things occur? What does that look like? And when are you most likely to see those positive behaviors? And I think this is really an important area to look at, in that you have different relationships and different positive behaviors that occur with different people. And so if you can identify what some of those things are, then you can increase those positive behaviors across people and really expand on those opportunities. And so then you want to identify, how often do they have the opportunity to exhibit those positive behaviors? And you want to make sure that as you're planning that there's lots of opportunities for that. You also want to look at some of the physiological setting events. And the setting events are things that we identify that make the problem behaviors more likely to occur. So if you have a setting event and then the immediate antecedent, which we'll talk about in a minute, occurs, then it's very likely, or it has a very high probability that that problem behavior is going to be triggered. And so some of these physiological setting events are things like medications. Are there medications that may affect their behavior? Are there side effects that could be affecting their behavior? And then are there ongoing medical or physical problems, such as pain, which is very common following brain injury? Could be seizures, headaches, any gastrointestinal issues, and then also frequent illnesses or allergies or things like that. So there could be things that are pre-injury medical problems that maybe before the injury they were okay and able to cope with those things, but now following their injury they are not able to effectively deal with that as well. So that becomes more of a problem. And then do they have normal sleeping patterns, or are there issues related to sleep? And so that can be a big setting event for people. And so we want to identify different strategies, and we'll talk more about sleep specifically. So, and then are they still experiencing fatigue? So one of the things that people with traumatic brain injuries experience is kind of mental fatigue as they kind of readjust and kind of heal. They get fatigued very easily, and that's something that can be ongoing as well, in that cognitive tasks can be more difficult and more taxing, and so that can cause fatigue. That then can cause irritability and acting out in problem behaviors. So identifying if fatigue is still an issue is an important area to look at. And what times of the day are they having more difficulties? That might be related to fatigue. It might be related to sleep patterns or other issues too. So looking at just times of day. And then any kind of dietary or eating problems that they might have, such as fluid restrictions or calorie restrictions, any kind of swallowing difficulty or any kind of feeding tubes or anything like that, that could impact their problem behaviors. So restrictions on fluids or calories are an area that I've seen a lot of problem behaviors come from, and so that might be an area that you want to look at. And then has their ability to participate in highly preferred activities been limited by physical impairments? And if so, how? So this might be an area that if they are not able to do some of the things that they really enjoyed before, that they might be having problem behaviors related to that. So really looking at kind of how their life has been impacted and their preferences have been impacted. Then we also want to look at environmental or social setting events. So we want to look at, again, most and least successful activities where they, either have more problem behaviors or fewer problem behaviors, so that you can really identify those successful environments or less successful environments. And then what activities in the day are predictable? Do they know what's coming up? Do they know what to expect after one activity ends and another begins? What's their expectation throughout that day, and are those things predictable? And then is it clear, even as far as who they're going to be spending time with and for how long? So just making things predictable, and what predictability do they have in their day, as well as what choices do they have throughout their day? Do they have choices during breaks or free time? Do they exhibit appropriate choice-making abilities? So do they make appropriate choices? Or do they know how? So, for example, if you give them two choices and they always pick the first choice, or they always pick the last choice, then that might be something that we need to teach around, so that they can start to choose things that are truly their preference and not just the last thing they remember. And then also, how do they respond in noisy environments, crowded areas? Also, are there fluorescent lights or background noises or flickering lights in the environment? All of those things could impact their success. So, excuse me, if there's background noises, they may not be able to filter out those noises the way that you and I might, and so that could impact their ability to attend. You and I might not even notice that it's occurring, but it is, and they are picking up on that. Or flickering lights could cause headaches. Fluorescent lights are just a big problem for a lot of people. And then also, you want to identify successful strategies, that are already having success. So can the student complete a task if they're shown how? So does modeling work? Is it effective? If you give examples of ways that they can do it or apply it, can they do those things? How does the student communicate yes or no when given a choice or being told something to do? So do they appropriately say yes or no? Do they opt out appropriately? Or do they say yes that they do want to do that? And then going back, I'm sorry, to the last one, that if you're showing them how, you know, is it something that if you present a couple of, like a sequence, how many things can they do? Or, you know, just really assessing what their level of independence can be with that. So, and then describe what actions improve the likelihood that activities for their day will go well. So are there certain things that you guys are already doing that help the day go more smoothly? And so you want to identify those and have those really identified and listed out so that other people can do those things as well. And then describe what things are being done to avoid interfering with or disrupting an event or activity. So are there things that are already being done that prevent, you know, disruption? And then describe the things that the student likes, you know, or finds reinforcing. So are there favorite foods? What are some things that they like? Are there their favorite games or toys? Are there in-home activities that are their favorites? Are there community activities that they really enjoy? And then just really listing out other events, people, or activities that they just really like to do. So that you have a comprehensive list of important and preferred activities and things. And then we'll look at, I'm sorry, we have another question?
Yes, thank you. Have you experienced these factors typically coincide with one another, like medicine causing abnormal sleep patterns or abnormal eating problems?
Medication can impact all of that. So really consulting with the physician, you know, being involved with parents and having open communication about what those potential side effects are, and then being able to look at alternatives if they're really struggling with some of those things. So, I mean, medications can help with sleep and they can hinder sleep. So that's always something that you really want to have the full team kind of communicating about so that those things can be addressed. I hope that answers that.
I think you can move on.
So then we'll go on. Okay. So then we will talk about the importance of direct observation. So we really want to observe in the classrooms, in the different settings. You know, and this is important for a couple different reasons. You know, when we're in the teaching environment and we're the one providing that instruction or providing the, you know, having those interactions, sometimes it's difficult to assess all the different things that might be going on in that environment because we're in it and we're maybe distracted by other things as well. So it's important to have somebody else kind of come in and do some observation so that you can gather more information about what's going on in the environment, so that might impact things. So we'll talk about some things that you want to do there. So with your observations, you're going to identify those immediate antecedents, so those things that are most or least likely to trigger those problem behaviors. And so again, you want to look at not just what is most likely, but also what's least likely to trigger those problems. So looking at settings or places, times of day, people, activities, and also known actions. So something that you could do or say that you know is going to lead to that problem behavior, or things that you know you can say that prevent or decrease the likelihood that that problem behavior is going to be triggered. So, so tone of voice, for example, or specific phrases or words, so giving corrections or redirections. There could be specific things that you say there that you know will lead to problem behaviors. So really identifying all those different areas. You also want to look at, you know, what does the student do if they're asked to complete a difficult task? What do they do if a highly preferred activity ends or is interrupted? You know, what do they do if there's a sudden or unexpected change in their schedule? So you're looking at different situations that commonly can trigger problem behaviors, and really, you know, specifically looking at that. And then also looking at a preferred item or activity is visible, but they need assistance to obtain it, or that preferred item is not available, they're asking for it, and they're being told no. So that could be an area that you want to look at as well. And then what happens if the student's in a room with other people, but nobody is interacting with them? You know, and we'll talk more about analyzing that as well. And then what happens immediately after the problem behavior occurs? So when we're talking about consequences, we're not talking about the punishment or the consequence that they're given for that problem behavior. We're talking about what happens right after, immediately after that problem behavior occurs that could be contributing to the likelihood that that problem behavior will occur again. So is additional help or attention given? You know, are they given a reprimand or a redirection? Are they able to not then have to complete the assigned task? Do they get time alone without any demands? Or do they have access to, gain access to a preferred activity or an item to calm down that, you know, once they have that problem behavior? So one of the things that I will frequently see is that kids will be able to go to a sensory room. Well, the problem is that if they don't have access to that sensory room at other times when they're doing well and they're having positive behaviors, then you could create a pattern of reinforcement that they gain access to that when they have a problem behavior. So you want to avoid that, so you need to assess it and see if that's what's going on. And then does the student obtain something following the problem behaviors? Do they get a back rub? I've seen this recently, that you know, they start to kind of get escalated and they get a back rub to help them calm down. But otherwise, they do not get any physical affection when they're doing great. And does the student escape or avoid something following the problem behavior? So are they able to get out of you know, cleaning up or doing a chore or you know, an academic activity? And then you want to observe across different settings and activities and discuss these things across different settings and activities to really be able to get a complete picture of what's going on. And then, you know, because one of the things that you can see is that if they're being reinforced in one setting but not in another, then that problem behavior may occur in other settings, even though in that setting it doesn't get reinforced as much. So you want to identify across all those different settings to get a common themes. And then you want to observe and identify the consequences with positive behaviors as well. As I kind of mentioned before, how many opportunities do they have for positive behaviors, you know, to exhibit those social behaviors, and you know, how often they, you know, what happens afterwards. So for example, if you have a child who is raising their hand but never gets called on, then, you know, their positive behavior is not being reinforced, whereas then they call out and they yell out the answer and the teacher immediately responds, then that's more effective for them. And so that would be something you want to look at for positive behaviors as well. All right, so then what, also you want to look at what functional alternative behaviors does the student already know how to do. So when you're looking at, you know, what do they get out of it? Do they get adult attention? Well, do they know how to elicit adult attention or peer attention appropriately, or is that an area that we need to teach? Do they know how to request a break or escape from demands without disrupting the environment, or again, is that something that we need to teach? Can they gain access to preferred items or activities without disrupting the environment again? You know, all of these things need to be appropriate, and so that would mean that it's not going to have disruption or other problem behaviors to gain access. And then you want to make sure that it's functionally equivalent, meaning that once you identify what is occurring as a consequence that they're gaining access to, such as adult attention or a break or access to an item, then you want to teach the functional equivalent replacement behavior. So what is that alternative that we can identify? And then how does the student communicate with others? So this might include speech or signs, gestures, communication boards, or electronic devices, or it could be, you know, just verbally, as I mentioned there. And then is that effective? So is their communication getting them what they need? And then are there problems with the assistive communication systems that they might be using? So, you know, is it maybe taking too long, and people, peers or teachers are not able to take the amount of time that it's necessary to, for them to use it. That might be an area that we either need to look at alternatives, or we need to ensure that everyone has time, because sometimes those electronic devices can take longer for that person to communicate. And then how are their receptive communication skills and their ability to understand others? So can spoken requests or instructions be followed, without visuals, or can they do that on their own? Something that's common both in brain injury is that you can have situations or an individual who has great expressive communication, and they can communicate lots of different things, but their receptive communication is lower, and so they appear to be more high functioning than they really are. And so you have to really identify those receptive communication skills and make sure you've got a good understanding of both. Or like vice versa, you might have somebody who's got great receptive communication skills, but their ability to speak is impacted, or it takes them longer to speak, and so that impacts how people see their and receive their expressive communication. All right, so then we also want to look at, are there any questions before I guess we go on? We look like we're good.
Yeah, there's none posted at the moment.
Okay.
I'll let you know.
Okay, perfect. And so then we also want to look at some ways that we can collect data, both in the assessment phase and then also as an ongoing data collection method to see that our interventions are successful. So here's one that I use mainly during the assessment phase, and this is just an anecdotal record where the staff or parent will write what kind of was going on beforehand. So I'm sure that you guys are fairly familiar with this, but you've got an antecedent, so what was going on beforehand, you've got the behavior, so what happened, what did we do, and then the consequence, what happened immediately following. So what did you do, what changed in the environment, or what were others' responses. So you're just kind of writing a description of all of those different details. And so this is something that I'll often give to, again, the teachers, parents, other staff, just while I'm doing the assessment. And then this is an example of a scatter plot data sheet, and this helps us identify times that are more likely to have problem behaviors, as well as identify frequency, and gives us a lot of different information. So for this one, and there's a couple different ways that you can do this. For this one, you've got an open box would be that no behavior occurred, so you wouldn't fill anything out. A single slash would that 1 to 6 occurrences occurred during that 30-minute interval. Or an X would be that 7 to 11 occurrences happened within that 30-minute interval. Or a totally blacked out box would be that 12 or more occurrences happened within that 30-minute period. And one of the things that I like about this is that it's easier to collect than just a frequency tally, in that you're doing either 30-minute, or I've got some cases where I do hourly, and then I also have some cases where I do morning, lunchtime, and then afternoon. So there's lots of different ways that you can do this. But I think in terms of assessment, you want to identify a little bit more detail, and so you're looking at 30-minute or hourly time frames. And then one of the things that with this is you have the dates here, and you can identify what activities were occurring on those different days. So let's say you have art that occurs twice a week, and you start to see that on those specific days, that's when the problem behavior is occurring during that time frame. Whereas on other days, when you don't have art, then it's not occurring. So you can kind of identify more specifics using this type of form. Another way that you can do this is to do intensity. So you can do a low intensity moderate intensity, and then high intensity. And with that, you would identify what those, what the low intensity, moderate intensity, and high intensity would look like in terms of problem behaviors. And then you can identify, use those same indicators for those types of behaviors. So that's kind of easy for people as well. So those are the two types of data sheets that I use during the assessment, and then again the scatter plot I'll use following assessment as well. Another thing that you can use when you're doing your observations, I just take I just write notes, and so I tally, I write down the context, I write down where they're at, I write down what people are saying, all of those different details. And then afterwards, when I'm analyzing the data that I've taken from my observations, I use this form, which is a structured ABC analysis. And so I list out the problem behaviors, I list out the date, what adult was working with them or supporting them, and then where the behavior occurred. So for each problem behavior that's in my notes, then I will say, okay, that happened in the library, so I'm going to put an X in the library. And they were ignored by the teacher. Then they had the problem behavior up here. And then afterwards, they were told to stop. And so I put an X there. And so for every instance of that problem behavior, I'm listing that out. And so sometimes I'll use 3 or 4 of these sheets, and sometimes I'll use 6 or 8 or more, depending on the frequency of those problem behaviors. And then after I've tallied all of those things up, then I count how many occurred in this row, and then how many occurred in this row, and down and so forth. And so then I can look at how many were related to attention, how many were related to gaining access to things, how many were related to escaping a demand. And so I do that both for the antecedent and for the consequence. So what happened before and what happened afterwards. Now one of the things that's important to note here is that with the antecedent, attention is that there was no attention being given. So they were ignored by a peer, ignored by a teacher, or they were alone with an activity and did not have any interaction. If it's an antecedent and it's related to things, gaining access to preferred items, then that means that they did not have access or that they were denied access. So the object was denied or removed. And then again with escape for the antecedent, it was that they were given a direction or that they were provoked by peers. Those are the two examples here. And so that would mean that they were told to do something, or they were in an unpleasant situation and that they wanted to then escape. The automatic reinforcement is here, and that is more kind of an internal event or a sensory event. So, for example, they were alone with nothing going on, and they started to headbang. And then nobody did anything. It was again ignored, and they continued to headbang. So that could be related to pain and relieving pain or migraine. And so that might be an internal event that is not something within the environment. Okay. So I know that there could be lots of other questions on this, but that helps identify that function that we were talking about. And so, again, more questions. If you have specific questions about this or want to use this form, that's something that we can email about as well. All right. So then once we've gathered all of that information, we want to look at the problem, kind of all the problem behaviors, all the information we've gathered, and work as a team to identify kind of what's been going on and what we need to plan for. So with this, I'm going to, as I'm doing that analysis, I look at all of the different setting events that were identified. And so I list those out here. And then I look at all of the immediate antecedents that were identified. So being ignored, provoked by peer, all of those types of things. I'm going to list those out here. And then I'm going to list out the problem behaviors, and I usually try to list out either specifically related to the antecedent, or if the problem behaviors just kind of escalate, then I list them least to most severe. Okay, so I can see that sequence again. And then I list out all of the maintaining consequences that were identified. So they were told to stop, they were reprimanded, they were asked to leave, they escaped the demand. So whatever maintaining consequences might be listed there. So let's go through an example of this. So for this example, for the setting event, this child, when they got less than 6 hours of sleep, they would have difficulty with transitions when they were asked to speak in front of the class or asked to write. And what they would do in that situation is they would scream, hit others, or hit themselves. And so those are the problem behaviors that were identified. And then what would happen as a result is that they would no longer have to transition, they would no longer have to speak in front of the class, or they would no longer have to write whatever was assigned. And so that's kind of the setting event, the antecedent, that problem behavior, and then those consequences. And one of the things that we also identified is that an appropriate alternative would be to request a break. So if they requested a break, they could escape the aversive tasks, and that would be an acceptable alternative to that problem behavior. What we really want them to do is to complete the task for the activity. So that's the desired behavior. And if they do that, then we would praise and then give them access to a highly preferred break activity. So they would have a break, also praise, but they've completed the task. So that's kind of what we would like to occur. But if that's not, oops, sorry. There we go. If that is not something that they're able to do, then we will accept a request for a break. Okay? So that's an example of how that would work out. And let's go through a little bit more as well. So we want for each identified problem, so the setting event area, the antecedent area, the behavior, and the consequence area, we would want to identify strategies that we can use during each of those times. So we'd want to identify what happens if they have less than 6 hours of sleep, what things can we put into place to help decrease the impact of that problem. So I'm going to go through an example of that. So again, we have the setting event strategies. The parent contacts the teacher to alert them of a bad night's sleep, and then the teacher adjusts how many difficult demands they're going to make. The nurse provides an opportunity to take a nap. The classroom assistant provides more one-on-one attention. Okay, so there's some examples of setting event strategies. And again, then for the antecedent strategies, we might use a picture sequence to prompt transitions. We'd want to intersperse difficult tasks with mastered and easy tasks, things like that. So for each area, we'd want to plan and have some teaching activities for getting through that and for them to learn the appropriate skills. So we would teach them to request a break, teach them to ask for help, things like that, okay? And so, so that's kind of the assessment process, and that's how you're going to kind of build that plan. We are going to go on, let's see, how could we use something like this if the school is not willing to use it? So the question is, how could we use something like this if the school is not willing to use it, or do we find out what kind of format they have similar to this? So all of these strategies that we've listed here are really looking at and completing a functional behavior assessment in some of those parts. And that is part of those the skill or the strategies and the tasks that the school is required to do. And so that would be something that you can use and give as suggestions for their functional behavior assessment. And then another question is, could these strategies turn into a safe routine for the individual to use always to get out of activities? So that's where you want, so for example, in this, that's a good question. So in here, when we're teaching them to request a break, and that is something that helps them get out, it helps them escape the aversive tasks. Now, that break is not a preferred activity. Okay, it might be, sitting in the hall or putting their head down on the table, and so it's not going to. You also have to provide that reinforcement and provide kind of a greater benefit to them, meaning that they're going to get a highly preferred break activity to help them to learn and complete that task more appropriately. So you have to do multiple steps here. So we're teaching them to complete the activity and highly reinforcing that, but we're also giving them a replacement behavior that fulfills that function, because we don't want them to be screaming, hitting others, or self-slapping. So that's where we have to decide what is an appropriate alternative that we're willing to accept. And that's kind of how we work through that. You want to make sure that you've got another alternative that is highly reinforcing to avoid that. Okay. All right. So then what we're going to go through next, and I want to make sure that we have enough time, is we're going to just briefly go through some preventative procedures, and then we're going to go through some case studies. And so preventive procedures are things that are within your control, that can be applied whenever things are going well. And so you don't want to wait for the crisis or wait for the problem behavior before you take action. So these are things that really focus on teaching new skills, reducing those challenge behaviors, and increase their quality of life. So we want to provide behavior-specific praise. Make sure that we're telling them exactly what they're doing that's good, and that we want to see more of. We want to watch for positive things, actions, and behaviors, and comment on them. The more attention that we give to positive behaviors, the more we'll see those. So that one of the things that I always tell people is that what you pay attention to is what you're going to get. So if you pay attention to the positives, you're going to get more positives. And one of the nice things you can also do is public praise. So that is praising someone in front of others to really gain that that public awareness that they did well. So it can really build self-esteem as well. But another strategy and kind of another way you can use that is to use public praise towards another student, and that can prompt that positive behavior in that target student or the student that has the brain injury. We also then want to reward appropriate incompatible behaviors, appropriate alternatives like we had talked about, or we can also reward the non-occurrence of an inappropriate behavior. So let's say after, at each transition period or each class period, we could give them a token or a dollar, whatever your school might have, to reward not having a problem behavior during that time frame. We also want to make sure that we're pre-teaching and foreshadowing events and activities that are going to be coming up, and really giving them the details of what they need to expect. And this helps us plan ahead, plan for activity. One of the key things with this that we want to make sure is that we are allowing time for the person to respond. Things like processing speed might be impacted, and so we need to sometimes allow more time. What that also means is sometimes we have to stop talking to allow them time to process, and so that would also be important. Engagement and per opportunity is also very important in that kind of trying to teach as things occur, as they're in the natural environment, as well as just functional and normalizing activities, because that's going to promote independence and promote skills. You also want to make sure that, a lot of times we'll have problem behaviors occur more during unstructured times or during recess and things like that. And that's where we need to provide some more structure to that area. Another thing that we want to look at is errorless teaching. And this is where we want to teach them how to do something without making mistakes. And so whereas most of the time we're looking at a least to most prompting sequence when we're teaching a new skill, we really want to focus on a most to least, in that we're providing more prompts at the beginning to build success and make sure that they're doing it correctly the first time and subsequent times, and then decreasing and fading out our prompting as ways to increase their successes. As we've talked about, we want to teach functionally equivalent behaviors to replace those challenging behaviors, and that we want to make sure that their communication is being effective, in that they can express their desires and preferences without disrupting the environment. And so if they're not able to do that without disrupting the environment, that's an area that we need to teach more. We want to make sure that they have opportunities for choice and control, and that we're embedding choices throughout their day, providing schedules, structure and consistency, as we've already talked about. And then we also want to teach problem-solving skills. Problem-solving skills is one of those areas that is a very common area that I've seen impacted. And so this is an example of a problem-solving worksheet that you might be able to use. You want to generally start with something that's very non-emotional, just a very positive, kind of easy problem, and have them give you suggestions. And then you'd have the situation. You'd list out the options. What could you do to solve that problem? And then what the disadvantages are, what the advantages are, and then again what the best solution is. So that's where the SOTA's acronym comes in. And then you can, as they get used to this and are more reinforced by this process, then you can start to talk about more difficult situations or problems that they encounter and build that skill that way. Sometimes you have people who have more difficulty with the disadvantages and the advantages, because those are things are more abstract. And so you can use the SOS sheet, which is just what's the problem, what are the options, and what's the best solution. So if you have somebody who's really black and white and has difficulty with that abstract thinking, then this might be a better option as well for you. And you can write it down for them. They don't have to write it. You can just use the format to go through with that. So, all right. So then let's go through a couple of case studies. The first case study is a 10-year-old who is 10 months post-traumatic brain injury, and he was having aggressive behaviors both in the home and in the school. And he did have a pre-injury diagnosis of bipolar, Asperger's, and ADHD. So he had a lot of stuff going on even prior to the brain injury. And the brain injury then impacted, he had severe deficits in executive functioning, memory, initiation, and sustained attention. So even with things that previously interested him, he was not able to maintain attention with it. So we're going to talk about more of what strategies we can use for those specific deficits. And then he perseverates a lot on things and often needs assistance with transitions. And then had difficulty with short-term memory storage, and appeared to have difficulty retaining new information, whether it was given auditorily or visually. So he really had difficulty gaining new, learning new information. And so that really impacted his education a lot. So he did seem to retain what he had learned prior to the brain injury, but had difficulty with new information. So some other information is he is aware of difficulties that he's having that he did not have prior to the injury. So that really impacted him a lot with a lot of stress, anxiety, depressive symptoms. He does report that he remembers being able to do things very well and that now he's not able to do those things. So he is very upset by that. He also had experienced seizures at different levels of intensity and frequency. There was some question as to whether or not these were pseudo-seizures or whether he did have actual seizures occurring. And so that we looked into that a little bit more. He did have abnormal brain activity, but there was not a discernible pattern. So it is proposed that he had both pseudo-seizures as well as some real seizures. And so pseudo-seizures can be frequent when there's a lot of anxiety and stress. And so we wanted to make sure that we were addressing that as well. So we did have some of the things that we put into place were that high levels of structure and support. We want to make sure that we had very clear expectations, frequent cues for daily activities, a use of a schedule, and established routines. We also used first then just in our conversations as well as it's time to do this. One of the things that when people have difficulty with initiation is that if you say, do you want to do this or yes or no, they are like, well, you know, not really, I'm okay. Or if you say, you know, do you want to get ready for this, then they won't do it. So if you can set it up with it's time to do this and a visual schedule, then they can be much more successful with initiation. And then a lot of pre-teaching, small class settings to avoid those crowds and overstimulation. Frequent breaks due to the fatigue and memory. And then a lot of repeated information, so a lot of repetitions. Engaging in memory strategies to really help him remember those everyday activities and events. He wanted to be able to remember what happened this morning, and so he would write those things down. And then using a calendar to record upcoming events and appointments. And then we used a lot of praise, just really trying to build his self-esteem and his recognition of strengths, as well as then group engagement and social skills training. And we used the sodas with him. So those are some examples there. This is an example of what his morning or afternoon schedule looked like for home, which is also something that we did, so that we would, you know, kind of help with that that schedule and that structure that he needed. And then we also used something similar to this with a daily note, so that to help him transition to his next class. And you know, did he have this also set up all of the rules for the day for that class? And so that helped with his expectations. We also did, this is some examples of social skills types of instruction that we did. So following instruction, looking at the person, nodding or saying okay, doing what they've been asked right away. Accepting no, looking at the person, nodding or saying okay, staying calm, and then, you know, if you disagree, coming back later and asking later. So, all right. So then one more case study. So we have Kevin, who has a history of TBI and ADHD and has just really high rates of disruptive behaviors in the classroom, just incredibly high. And I'm going to go through what those rates are in just a minute. But he gets very distracted by others, sees someone get up, ask a question, anything, he becomes very disruptive. So in the morning we observed, I didn't observe during recess and breakfast, but he had very high rates, so more than 1 per minute during this time frame, disruptive behaviors. And then he started to take a test, and the teacher and I discussed an intervention So we went ahead, I'll go ahead and describe that real quick. We had a class-wide intervention, so we didn't want to single him out, but the teacher delivered behavior-specific praise, had the student put their name up on the board, and then throughout the day, the students added check marks next to their names. And then at the end of the day, they received a prize. And no specific behaviors were identified, and not all the students received a check mark for those same behaviors. So that enabled a lot of flexibility. The teacher was able to prompt appropriate behavior using that public praise that we talked about before, and then redirection was still given as needed. And so following the intervention, we decreased the rate of disruptive behaviors quite substantially. So he was, had 2 occurrences during this 2-hour period here. And so during the baseline information or observation, he was having, on average almost 1 per minute. And then after the intervention was implemented, he had 1 per hour as an average. One of the things that was very interesting was that because the class-wide reprimands continued, we didn't give any instruction with that. During the baseline, there was an average of 24 redirections per hour, and then that went down to 1.7 per hour. And he was not the only child that was being redirected. All right, so then in conclusion, proactive interventions are a critical component of treatment and behavior intervention plans, and ensuring that ensuring access to highly preferred activities or items. We want to make sure that they have access non-contingently to certain things. So what are those most important things? We want to make sure that they have access to those not related to whether or not they're having problem behavior or, that not just as reinforcement. So really try to build a rewarding schedule as well as providing reinforcement for appropriate behaviors. And then students with TBI will have greater access to community supports and meaningful social interactions when challenging behaviors are minimized. And students with TBI frequently have additional medical or neuropsychological needs that increase the complexity of managing their challenging behaviors and require additional supports to achieve a high quality of life. All right, so then there is my contact information. Thank you very much. I think we went over by just a couple of minutes, so please let me know if you have specific handouts that you'd like, and then if you want copies of the slides, you can also email me, and I can forward that to you. So please let me know any questions or any information that you need from the presentation. Thank you very much.
Thank you, Maheen. I'm not seeing any final questions, just a thumbs up from a attendee saying great material.
Okay.
So thank you very much. And thank you everyone for attending. When we close out again, I would just want to remind you that a evaluation for the presentation today will pop up on your screen. Please take a moment to complete that. And then those of you that do, I will be sending out an attendance certificate to you via email by the end of the day tomorrow. So I will check just one last time to see if there is any questions. Just some more thank yous. So with that, oops, someone raised their hand maybe. Hold on. Let me see if I can see. Sherry, you have your hand raised? Oh, no, she took it down. Okay. So I think we are good to close. Thank you again, Maheen. Always great to hear you present, and very wonderful material. So thank you everyone for attending today.
Thank you.